Hello, I'm Dr. Sundari Mace, Sonoma County's Health Officer. I'm here to share the latest updates on coronavirus in Sonoma County. As of today, April 30th, there are 232 confirmed cases, up 4 cases in the last 24 hours. Of those cases, 125 are active, 105 have recovered. We still have the 2 deaths that we have reported, and now we have performed 5,690 tests. So today I'm going to talk a little bit about the governor's strategy. As you know, in mid-April, Governor Newsom did identify 6 key indicators to guide California's decision-making for modifying the stay-at-home order. The first indicator was all about the ability to test, do contact tracing, isolating, and supporting those who are positive for COVID and those that are exposed to COVID. The number 2 indicator was to protect our high-risk people from becoming infected with COVID-19. Third indicator was to help hospitals and health systems handle surge capacity. Indicator 4, to develop therapeutics like vaccines and treatments to meet the demand. Indicator 5 was to monitor and support the ability of businesses, schools, and childcare facilities to follow physical distancing guidelines and other mitigation measures. And indicator 6 was to establish benchmarks and a process for reinstituting certain mitigation measures, like shelter in place if needed or if warranted. So on Tuesday, the governor did also release California's new resilience roadmap, which is a staged process for reopening. There are 4 stages that lay out the sequence of conditions necessary for ending our stay-at-home order in California. So stage 1 is all about safety and preparedness to make essential workforce environments as safe as possible. This is the stage that we're in right now. Sonoma County has made significant progress in implementing essential practices to fulfill stage 1 requirements. So far, we have promoted safe practices through issuing sector-specific guidelines, expanded testing and contact tracing, as we've been talking about for the past few weeks, and ensuring that healthcare providers have PPE. And we've also opened an alternate care site to help hospitals manage any surge in cases and to help isolate our cases in the need that they need to be isolated outside of their houses. Stage 2 is to lower the risk in workplaces, creating opportunities for lower risk sectors to adapt and reopen, modify school programs, reopen childcare facilities. So we're laying the groundwork now to enter stage 2, where we gradually open lower risk workplaces and prepare for educational sectors to resume activities. Stage 3 is to move to higher risk workplaces. So this stage would allow for higher risk business sectors to adapt and reopen using our guidelines, like the physical distancing guidelines and the general guidelines we've put out. Now, stage 4 would be the end of the shelter-in-place order. This stage would allow for the highest risk workplaces to reopen and would allow for us to actually end shelter-in-place when all the indicators are met and effective COVID-19 treatments, including a vaccine, have been developed. So we'll keep updating you as we get through each stage here in Sonoma County. Right now, we're in stage 1 and moving along quite well. So let's get to our community questions. One of the questions is, will the shelter-in-place order be lifted or changed next week? What are some of the changes being considered? I'll be signing a new health order tomorrow. Getting people back to work is a priority, and adjusting to a new way of working for businesses and consumers will be necessary to do that. The new health order will align Sonoma County with the governor's framework of the 6 key indicators that I've just been talking about today. The second question from the community is, when will we know the results of expanded testing? How many healthcare workers are testing positive? Test results are just beginning to come in. When we get results, we will put them up on SoCoEmergency.org. When we have a complete report on those results, we'll share them with the community. Thank you very much. Be safe and healthy, and we'll talk again tomorrow.